1 million. Seriously, take a second to just let that number sink in. We're talking about the staggering number of new cases diagnosed every single year in the US alone. You know, when we talk about medical conditions that disrupt lives, cause unspeakable agony, and basically send people rushing to the emergency room, we aren't talking about some rare anomaly. We're talking about a massive, widespread health issue that is happening all around us, literally every single day.
And hey, if you think you're entirely immune, check out this data point. Medical experts estimate that 10% of all Americans will suffer from this condition at some point during their lifetime. 1 in 10. That means if you haven't experienced it yourself, there is a super high statistical probability that someone in your immediate family, a close friend, or a coworker has. It's a completely normalized condition, yet it carries a reputation for being one of the most painful experiences a human being can possibly endure. Okay, let's dive into this. Welcome to this explainer, where we're going to break down absolutely everything you need to know about kidney stones. We'll be drawing on clinical insights from Corewell Health, along with top medical professionals and nephrologists, to bring you a complete picture. We are going to demystify this whole condition, strip away the panic, and replace it with pure, structured understanding.
We'll be following the patient journey today. First, what exactly are they? Second, recognizing the symptoms. Third, diagnosing the problem. Fourth, treatment options. And finally, prevention.
Section 1. What are they? Let's get into the basics.
So in simple medical terms, a kidney stone is a solid piece of material that forms in a kidney when there are high levels of certain minerals in your urine. The vast majority of these are calcium oxalate stones. Basically, when your body has too much waste and not enough liquid to wash it all out, these minerals start to crystallize and stick together. They form these hardened deposits that honestly often start no larger than a single grain of sand. But here's the catch. They aren't smooth like river pebbles. Nope, they are jagged and incredibly sharp. And that is exactly why they cause such severe, debilitating pain when they begin to move through the delicate plumbing of your urinary tract.
Moving on to Section 2, recognizing the symptoms. So what does the onset actually feel like? How do you know if you're just dealing with a standard stomachache, or if you're part of that 1 million a year statistic? Well, the body's warning system often begins with unexplained abdominal or back pain. And this brilliantly illustrates what we're talking about. This isn't just a dull ache. Patients frequently describe it as a sharp, cramping pain in the back and side, often radiating down to the lower abdomen or groin. Then there's hematuria. That is the medical term for blood in the urine. Because those stones are so sharp, they can literally scrape the inside of your ureter as they travel, causing visible bleeding. But please, don't ignore the silent early warning signs either. Sometimes your kidneys will show signs of distress or decreased function way before the massive pain hits. This is exactly why paying attention to your overall kidney health is so absolutely vital.
Section 3. Diagnosing the problem. Once you recognize those symptoms, how exactly does a doctor confirm the diagnosis?
The clinical procedural flow here is incredibly straightforward but highly precise. First up, the doctor evaluates your physical symptoms and your medical history. Next, they rely on medical imaging, usually a CT scan or an ultrasound. This totally takes all the guesswork out of the equation. Imaging allows the doctor to see precisely where the stone is located in your urinary tract. And finally, and honestly most importantly, they determine the exact size of the stone. Why is size such a big deal? Because the size of that hardened mineral deposit dictates absolutely everything about how long it will take to pass and whether your body can even do it on its own.
Which brings us to Section 4, Available Treatment Options, the Medical Resolution Phase.
So the treatment path essentially forks into two very different directions based on patient outcomes. On one side, we have passing the stone naturally. If the stone is small enough, usually under 5 millimeters, which is roughly the size of a pencil eraser, your doctor might just prescribe heavy hydration, some pain medication, and time. You basically just wait for it to pass. On the other side, we have medical intervention. If the stone is too large, if it's blocking the flow of urine, or if it's actually causing kidney damage, waiting is just no longer an option. The clinical team has to step in.
So the crucial point here is that size absolutely matters. It is the single determining factor that separates a few days of really uncomfortable natural passing at home from a surgical procedure at the hospital. Medical professionals use this exact metric to safely decide between minor monitoring and major interventions.
Now, when medical intervention is required, modern medicine has some incredibly advanced procedures ready to deploy. First up is URS, or ureteroscopy. This is where a doctor passes a tiny scope into your bladder and up into your ureter to physically find the stone, break it into smaller pieces using a laser, and then remove it. Second, they frequently use ureteral stents. A stent is a tiny hollow tube placed right in the ureter to keep it open. This is a total game changer for pain relief because it allows urine to bypass the blockage, which dramatically reduces the swelling in the kidney. Lastly, there are certain types of less common stones like uric acid stones where specific medical interventions and medications can actually be used to dissolve them over time. Pretty amazing stuff.
And finally, Section 5, Preventing Future Stones. Let's talk about how to avoid all of this in the first place.
Look, getting through a kidney stone is an absolute battle. But once it's over, the focus really has to shift. The absolute best treatment is making sure you never get one in the first place or making sure it never, ever comes back. This is empowering knowledge that you can apply to your daily routine starting right now. Step 1. Clean out oxalates from your diet. If you're prone to stones, you have got to watch your intake of high oxalate foods like spinach, almonds, and certain teas. You want to pair them correctly with dietary calcium so they bind in your stomach, not your kidneys. Step 2, improve your overall kidney function through daily habits, primarily by drinking massive amounts of water. As they say, dilution is the solution to pollution in your kidneys. And Step 3, always follow nephrologist-recommended steps tailored specifically to your unique body chemistry.
We've seen the sheer scale of this problem. We've talked about the agonizing symptoms, the diagnostic procedures, and the surgical interventions required when things go wrong. But we've also seen the clear, actionable path to prevention. The tools and the knowledge are right here in front of you. So the only thing left to ask is, will you take the daily steps necessary to protect your kidneys today? Thank you so much for joining me for this explainer. Stay curious, stay healthy, and keep learning.